Hello there. So today I'm going to talk to you about kind of the pathology that we're looking for on teeth in cats and dogs whenever we're doing a dental cleaning. So most animals, when they get a dental, they get the clean, they get the polish, they get what's called probing, charting, and x-rays. Those are a lot of the ways that we look at the teeth. So the cleaning and polishing is what I talked about in the last video, where we get the tartar off of there, we polish any microgrooves we cause in the teeth. Probing, we actually take a little metal instrument that has a pointy tip that has little marks on it that are millimeter or centimeter marks, and we will stick that little probe very gently into the gums that are around the surface of the tooth. Every tooth has a certain amount of space in between there that is normal. The vast majority of teeth, it's something very small, like 1 to 2 millimeters. Your canine teeth have a little bit more. But we're looking for what are called pockets. So there's spots that the gum has pulled away from the tooth and areas that could allow infection into that spot. We're also looking for furcations, like I talked about in my first dental video, where you have space in between the roots that you can easily pass one of those instruments through. And we will go through the entire mouth and we will probe around every bit of each and every tooth. And we do what's called charting. So most animals, whenever they're under, will actually have a dental chart that looks like a skull of an animal and lists all of the teeth. And we will mark if there's any gingival recession, any pockets, any furcations, anything like that on teeth. And all of that information together helps us decide if there's any teeth that need to be extracted. A lot of clinics will also take dental x-rays, and this is where a lot of the money part comes in for people. Is dental x-rays are not the cheapest thing in the world, but I have seen many times where a tooth from the outside looks perfectly normal. We probe, we don't find any pockets, there's no pain, there's no inflammation on the gums, but we do an x-ray and there's an abscess on the root of the tooth that we would have only seen with an x-ray. So as much of a pain as it is, if you're already spending the money to put your pet under for dental cleaning, I do suggest dental x-rays, full mouth dental x-rays, to look at everything. Those x-rays also help if we extract any teeth. It allows us to visualize the area where it used to be and make sure we didn't leave any of the tooth behind. So that's kind of the things that we're looking for. We can also look for some of the bad stuff that we may have in certain cases where we get tumors of the gums or the jaw or blah, 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 but that's not going to be in your kind of basic prophylactic dental cleaning. So next, I'm going to talk about why these procedures are a little bit more expensive than they used to be for these kiddos, because that stuff has changed in the last 10 or 15 years when it comes to dental cleanings for animals.